Nights in the hospital are strange. Time feels slower, the halls seem longer, and the silence hums like it's alive. I have worked the night shift for over 8 years. I have seen things that would rattle most, but room 209 is the one I still won't talk about. Not unless you really want to hear the truth. It started on a Tuesday, late, around 3:12 a.m., what nurses call the dead hour. We had a storm overhead and the lights had flickered all night. Nothing new. But when the call light for room 209 blinked on, something felt off. I paused. That room had been empty for days. The patient, a sweet old woman named Mrs. Harrow, had passed away there just last Friday. Peacefully, the chart said. But when I entered the room that night, it wasn't peaceful. It was freezing, and the air smelled of something stale and sweet, like decaying flowers. The bed was still made, untouched. Yet the monitor next to it was flashing a steady rhythm, like it was reading a pulse. Beep, beep. I stared at it, confused. Then the bathroom door creaked open slowly, even though there was no draft. I called out, "Security," thinking maybe someone was pulling a prank. No answer. Then I heard a voice. "Nurse." It was barely a whisper, rasping, wet, coming from the empty bed. Stepped back, heart racing. But the monitor's beeping quickened. Beep, beep, beep. I turned to leave, but the door slammed shut behind me. I grabbed the handle. It was ice cold. Wouldn't budge. Then the lights flickered again. And for half a second, I saw her, Mrs. Harrow, sitting upright in the bed. Her gown stained, her eyes black and leaking, something thick and dark. She opened her mouth wider than it should go and whispered, "I came to trade my place for yours." Everything went black. I woke up on the floor, the morning nurse shaking me, confused. The door had been unlocked. The lights were fine. The bed untouched. But when I checked the monitor logs, room 209 had shown a heartbeat for 7 minutes, exactly 3:12 to 3:19 a.m. They moved the bed the next day, but nurses still say the call light comes on, especially during storms. And if you listen close enough, you can hear the beeping, beep, 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 and her voice barely audible just behind you. Newers. Some rooms never forget, and some patients never leave. Comment. Would you stay in room 209?